Ladies and gentlemen, please welcome Bay Area Bold co-chair and founder and CEO of Center for Youth Wellness, Dr. Nadine Burke Harris.
Well, thank you so much. It is really my pleasure and honor to be here, to have the opportunity to talk to you about something that is incredibly near and dear to my heart, which is the issue of adverse childhood experiences and how adversity in childhood affects health over the lifetime. And you know, whenever I talk to folks, when I start out, I just want to get a show of hands. How many folks are familiar with the term adverse childhood experiences? Awesome. And how many folks are familiar with the term toxic stress? Anybody? Anybody? Okay. So I do that for a couple reasons. One, to just kind of check in with the audience and see how familiar a lot of this stuff is. But also, the other reason is because it's incredible gratification for me. When I began talking about this probably, 5 or 6 years ago, I would ask that question, and maybe 3% of the hands in the room would go up. And so that really is a reflection on how far we've come in really what's a very relatively short period of time. I'll tell you, I came to this work really in my background with health disparities. So I have spent my entire career, I went to medical school, I went to public health school, and really my focus was trying to understand why do certain communities tend to have worse outcomes than others, and what can we do about it? And when I finished my residency in pediatrics, I wanted to be in a place where I really felt like I was needed and I could be part of improving outcomes for vulnerable communities. And so I came to work for California Pacific Medical Center, and I actually I did my residency at Stanford, and I was offered a position to join the faculty at Stanford. And my poor Jamaican mother absolutely freaked out. She said, "Nadine, Stanford faculty?" Right? Like, this was, for a Jamaican, that's like about as good as you can get. But California Pacific Medical Center offered me this position to be able to specifically address health disparities in San Francisco as part of something that was called the African American Health Disparities Initiative. And so I jumped at it. And when I joined the staff at CPMC, the first thing that I did was look at the data. And it took me about, I'll say 45 seconds before I said, okay, well, we need to open a clinic in Bayview-Hunters Point, because that was the area where we were really seeing the most striking health disparities. And in the time that it took to raise the funds to be able to actually get the doors open, I spent my time going around to schools and after-school programs and churches and tutoring, everything that you can imagine. And I said, "Hi, my name is Dr. Burke. We're opening a clinic here in Bayview-Hunters Point. Please send us your kids." And the funny thing that happens when people see your face day after day, and they see that you're not going away, and that you're saying the same thing, is that you actually they actually begin to believe you. And they begin to entrust you with the community's most precious resource, which is our children. And so when we opened our doors, they did bring us their children. And time after time, one of the things that I was seeing is that folks would bring kids and say, "Please, Dr. Burke, can you do something for Jimmy?" Right? Jimmy, he's fallen out in class. He's hitting the kid next to him. "Please, Dr. Burke, he's got ADHD. Can you put him on some Ritalin?" And I said, "Absolutely, send him on in." But when I did my job, and I actually did a thorough history and physical, what I found was that for most of the patients that I was seeing, I couldn't make a diagnosis of ADHD. which is attention deficit hyperactivity disorder. Most of the kids that I was seeing had such severe histories of trauma that for me as a doctor, it just felt like there was something else going on. And so I had a colleague, and then one day, my colleague came in and he said, Dr. Burke, have you seen this? And in his hand was a copy of the Adverse Childhood Experiences study. And this was a study that was done by the CDC and Kaiser. And together they looked at 17,500 people. And they asked about histories of what we call adverse childhood experiences. And these include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your adverse childhood experiences score. And when they looked at the data for this study population, what they found was two things, right? Two important things. One was that ACEs were incredibly common, right? So 2/3 of their population had at least one ACE, and 12.6%, 1 in 8, had 4 or more adverse childhood experiences. And then what they did was they correlated it against health outcomes. And what they found was that for folks who had 4 or more adverse childhood experiences, their relative risk of ischemic heart disease was 220%. For chronic obstructive pulmonary disease, it was 390%. For cancer, it was 190%. For depression, 460%. Suicidality, 1,220%. Now, as a pediatrician practicing in Bayview Hunters Point, I looked at this data, and the first thing that came to my mind is that if this is true, then our community is currently in the middle of a public health emergency. Right? Because if this is true, based on what I'm hearing from my patients about the amount of adversity that they are being exposed to, then the fact that the rate of diabetes in Bayview is 3 times what it is across town, or the rate of preventable hospitalizations for asthma and other things is so much higher than in other places, it's actually, it's not an anomaly, right? It's not a fluke. There are actually real biological reasons that are causing this. Now, as a person who is part of a community, trying to understand how do we do right by our kids? How do we give every child the equal opportunity to grow up healthy and thrive, right? For me, I wanted to get to the bottom of this because it felt like the root of the root. And so I threw myself into the research about how adversity gets under our skin. Why is it that we are seeing these terrible outcomes for folks who are experiencing high doses of adversity? And let me tell you, you don't have to get an MPH at Harvard. You don't have to do your residency training at Stanford to understand that what do kids need to be able to grow up healthy and thrive? Well, let's see, they need love. They need to have their basic needs met. They need to have a good education. They need food. They need shelter. They need safety. But as someone who's working with a community of folks who is doing this work, what I hear from my colleagues in our community is that they're working hard to provide a quality education for kids. They're working hard to provide after-school activities. They're working hard to provide opportunities for safety. And yet, for my colleagues that I'm working with, they're not always as successful as they would like to be. And the families with whom they find they have the least success are the families that they observe are experiencing the highest doses of adversity. So the question is, what if I, as a pediatrician, can do something that will contribute to the solution? And so we created the Center for Youth Wellness. And the goal of our organization is to prevent, screen, and heal the impacts of adversity on the health and development of children. And the first thing we did was dive into the science of what is the mechanism, right? Because when we understand the mechanism of a disease, when we understand not only which systems are disrupted, but how, then that gives us the opportunity to use those as targets for our interventions. But the first thing that we did was simply screen all of our kids, all the kids that come through the primary care clinic for adverse childhood experiences, because I know that if I have a patient and they put on the form that their score is 4, that child has double the lifetime risk for asthma, that child is 4.5 times as likely to be depressed. And based on the research that actually came out of our organization, that child is 32 times as likely to have learning and behavior problems. I know that based on what they do, the number that they put when they fill out the screening form. And so we are able to have a multidisciplinary treatment team to be able to provide best-in-class, science-based interventions in a holistic way. But in addition to that, we know that if we're trying to solve this problem, we have to do the direct service. We have to provide the best care. But we also have to do the research to evaluate which of our interventions work and which, frankly, don't work, right? And on top of that, we have to do the field building work to be able to shout it from the rooftops. Because one of the things that we found in the adverse childhood experiences study is that these issues are not just happening in Bayview Hunters Point or Visitacion Valley or Potrero Hill. The original ACE study was done in a population that is 70% Caucasian, 70% college educated. And the data that CYW has gathered from the state of California has told us this is not only a community problem, it's a statewide problem and, in fact, a national problem. In California, 61.7% of Californians have at least one adverse childhood experience, and 16.7% of Californians have an ACE score of 4 or more. This is a public health crisis. And the work that we are doing here in this community resounds out into the state and, in fact, across the nation. I believe that this is something that with the appropriate screening, with high-quality intervention, and with a community and holistic approach, we can beat this. This is exactly what Bay Area Bold is all about. I mean, I have to say, I love that name, Bay Area Bold, because we can no longer afford to sit back and assume that certain outcomes are just what happens in certain communities. It is up to us to invest both on the community level, the individual level, one-on-one, the systems level, to recognize adversity as the root of the root and figure out how we as a community begin to start with a foundation of healing. That's why we created the Center for Youth Wellness, and I encourage all of you to join us in this journey. Thank you.